Hey everyone, welcome back to theclinicaltrialsguru.com. Again, that website address is theclinicaltrialsguru.com. We love, I keep telling you this, we love getting questions. I mean, it's what actually fuels the blog. It fuels us to create more content, so please keep asking questions, whether it's on Facebook, Twitter, Google+. A lot of people are using Google+ now, Don.
Okay.
Google+, LinkedIn. You can talk to Don on LinkedIn, or just YouTube channel or the blog post. Just ask us questions. We love it. We got one from a guy in India. His name's Amir, I believe. Amir in India. He's asking if we can provide some advice or some tips on freelancing and consulting work in the clinical trials industry. And that's a very broad question. There's a lot of potential work to be done in the clinical trials industry. Now, I'm assuming you're either asking to be a CRA, which is a monitor, or working for a site as a freelancer, such as maybe a sub-investigator or even a patient recruiter, study participant recruiter. So we're going to try to keep it real general and give you some general advice on consulting and freelancing. I know that you, Don, you've done a lot of freelancing work. So Don would probably be the best one to give some advice here, and then I'll chip in too, because I've hired freelancers, so I can tell you what we look for there.
And I was one. That's how Dan and I met.
Yeah.
Years ago. But, oh boy, that is such a broad question. And the best thing I could say is that if there's something that you're really good at in the research industry, and you're comfortable doing it, you're very confident at it, then that's the area you want to go in. If it's recruiting, and I know in India you don't go directly to the population or the subjects, you go to the physician that would have the subjects. If you've got a base of physicians you work with, then that's what you do. You would probably want to make a deal with, if you have physicians that can provide the subjects, then you want to make a deal with the investigational sites and see if they will hire you as a contractor to find the physicians to help provide the subjects. That's one way to go. If you have CROs that you're working with, then maybe go directly to the CROs and contract with them on being able to find the physicians that can provide that. Or if you're somebody that's good at setting up sites, another good thing to do is be able to find the locations, be able to find the physicians that can provide the clients or the subjects for these research studies. And again, I would take that type of skill set, and I would go to the CROs and or directly to pharma, whoever might be offering the studies, and work out some sort of contractual deal with them as well.
Yeah, hopefully you've got your game plan where you already know who you're going to approach, whether it's a CRO or an investigational site. Sounds like you're looking at the CRO, so in that case you'd be like a CRA or a monitor. Be prepared to work your butt off. I mean, there's advantages to being an independent contractor for sure. You have freedom to choose what you want to work on. You've got more liberties. You're basically an entrepreneur running your own mini business, mini company. But there are some challenges there too. You got to make sure that you get a steady workflow, or else you'll have times when you don't have work. Exactly. And then you don't want to overbook yourself either, because you're going to burn yourself out. So just kind of, I mean, you're going to have to do a lot of hard work to actually find your balance, find the right balance for you.
It can be very rewarding working for yourself and being a contractor. I very much enjoyed it, but you also have to be willing to put the work in at the beginning. And there were times when it was nothing for me to work a 16, 17-hour day. And what you have to do is sort of as a contractor, think about. I used to think about, okay, I need to earn X amount of dollars to cover certain expenses I had. For instance, paying my mortgage, making my car payment, paying for my daughter's school, and things like that, paying for her education. And each time I would go out and I would find a certain amount of business to get paid for. I was says, okay, I've got my mortgage paid. Now I have to make my car payment. I go out and find business to pay that. Then I would go out and find business to pay for my daughter's education. Once all that was taken care of, then I knew any other business that I got, that was money that would go into the bank. But the good thing about it is that the work that you put in up front will last over a period of time. It doesn't mean you're going to sit down and not do anything from that point in time, but what it means is that now you have complete control over your time. I had reached a point where I was just working 4 days a week, and on Fridays, at that time my daughter was very small, and she was only going to school a half a day, so she and I would take off and go to the zoo, go to Disneyland, and do things together. So it allowed me the freedom to generate a pretty good income, and as well as spend time with my family, which is very important. The other thing I can say about going out there as a contractor too, make sure that you got everything lined up. Lay out your plan of action or business plan, which Dan and I like to debate about that. But lay out your business plan on exactly what you're going to do, what you're going to say, how you're going to approach people, and you want to work that. Lay out some sort of prospectus, financial prospectus on exactly how much money do you want to make. If you determine how much money that you actually want to make doing this contractual business, then make sure you break that down to 40 hours a week and say, okay, during that 40 hours a week, am I doing something that will benefit this business? Because you cannot, as a contractor, achieve what you want to achieve if you're doing something else during that period of time other than working on that business. I mean, I can go into a lot of detail, but those are some of the key things that I think you need to focus on and have your mind wrapped around.
Yeah, and being a freelancer sounds great. It sounds like I'm my own boss and all this other stuff, but there's a lot of hard work. You've got to guarantee that you've got enough work coming in, and guess what? When other people want to hire you as a freelancer, they don't care about the other jobs you have. They want you to focus on theirs like it's your only job. So if you have like 5 or 6 different jobs, different contracting jobs, you got to treat each one like it's your only job, and it's very easy to get burned out. But I'm sure Amar Yadav, you can do it. And let us know how it goes. Let us know how you're doing, and let us know if that's the approach you took. Sometimes being an employee is the best way to go about it. It's all up to you and what you want to get out of it. So this is for Amar Yadav, Dan and Don signing off from theclinicaltrialsguru.com, and good luck.
Thank you.